Hi, my name is Sarah Hawkins. I'm a nurse practitioner student at Auburn University, and I'm going to demonstrate myself performing 5 simple interrupted sutures. So prior to demonstrating, I first will discuss wound prep and wound care. So when a patient comes in with a wound, it's important to make sure that you first obtain a thorough past medical history, including the patient's HIV status, if they have diabetes, their tetanus immunization history, and their allergies to ensure that you're caring for the patient appropriately. You'll also want to know how long ago the patient got the wound. Preferably, you're going to want to suture a wound within 12 hours. You also want to know how the wound occurred, if it was with something dirty, rusty, etc. It's also important to consider where the wound is located, if it's still bleeding, if it's close to nerves or tendons, and if it's appropriate to suture, or if it's more appropriate to refer to surgery. Deep wounds of the palms of the hand and soles of the feet, full thickness lacerations of the eyelids, lips, ears, or penetrating wounds may require a surgery consult and may not be appropriate to suture. So for wound cleaning, you're going to want to irrigate the wound with saline or with water. You avoid betadine, detergents, or iodine, as these can impede the healing process. You'll want to irrigate the wound thoroughly with a syringe tip or with a tool that allows you to get into the wound enough to remove all foreign bodies and debris. So after a wound is sutured, you want to instruct the patient to keep the wound covered and dry for 24 hours. After 24 hours, the patient can then put Vaseline on the wound and wash the wound with water. The sutures will be removed depending on where the wound is located. The longer the suture remains in, the greater risk of scarring. So you want to leave the sutures in long enough for the wound to heal, but not so long to increase the risk of scarring for the patient. So for wounds of the face, sutures will remain for 3 to 5 days. For the scalp, they'll remain in for 7 to 10 days. Arms will be 7 to 10 days. The trunk and legs and hands and feet will be 10 to 14 days. Palms of the hand and soles of the feet, or areas over joints that are more mobile, may remain for longer, about 14 to 21 days. So for suture technique, you're going to choose a suture size, the smallest suture size that you can, to minimize scarring. The higher the number, the smaller the suture. So for the trunk, you're going to use a 3/0 to 4/0 suture. For extremities, you'll use 4/0 to 5/0. And for face, you'll use 5/0 to 6/0. Sutures of the scalp, you may want to use a Prolene suture, which is blue. And you'll do this because they will be visible through hair, especially dark hair colors. For deep wounds, you may use an absorbable suture for the deeper layers of the wound, and then a non-absorbable suture for more superficial layers. So let's turn to the practice kit here. So we have inspected the wound, we have gotten the past medical history, we've irrigated the wound, and we have numbed the area. So just to refer to that, when you do numb the area with lidocaine, you're going to use a syringe with the bevel up in the subcutaneous tissue along the wound. So along the wound on the subcutaneous tissue. And of course, also you're going to want to use sterile technique while suturing. So you'll have a sterile field, sterile gloves, and of course we'll have already completed very good hand hygiene. So for this demonstration, I'm going to use a nylon monofilament suture. And I have my tools here as well. So I have my scissors, pickups, and then the needle holder. So I have the needle with the suture on the needle holder here. So when you insert the suture, you're going to want to do it at a 90-degree angle and deep enough to penetrate the dermis. You also want to use a twisting motion so that you can hook the needle through to the other side of the wound about the same distance away that you inserted the wound on the first side. So I'll go ahead and demonstrate that here. And you can use the pickups to kind of position the skin where you'd like it to be. So I'm going to start in the center of this wound, and then again with that rounded motion, I'm going to hook the needle through and then pick it up on the other side and pull it through. When you pull the suture through, you're going to want to leave about 1 to 1.5 inches on the tail, so that way you can properly tie the knot. So to do that, you then will drop the pickups. You're going to pull the suture taut. You're going to wrap it around the needle holder twice, pick up the tail, and pull it through. And then the second time, you're going to wrap it around once, the opposite way, pick up the tail, and then pull it through. So that's one. So then we will proceed with some more sutures. So again, you're going to want to pick up the needle at towards the end. Insert the needle in the rounded motion. Hook it around. Pull it through to about 1 to 1.5 inches. Wrap it around twice. And then once the second time. And pull it through. And again. And it's important to go in that rounded motion so that you don't bend the needle. Let me just start that one over. Pull it through. And then once the second time, going the opposite direction. Okay. Then I'll go on the other side. Insert the needle. Hook it through. And that is 4. And then the last one. So again, using that rounded motion. You pull the needle through. Oop. And that's why you leave that 1 to 1.5 inch tail so it doesn't go all the way through. That's a good what not to do, so let's try that again. And then leave that tail. Wrap it twice around. And then once. And there you have it. All right, and then again, once you're done suturing, you're going to want to cover the wound and instruct the patient to keep it covered for 24 hours and to keep it dry. So that is my demonstration of 5 simple interrupted sutures. Thank you.